So welcome everybody to this session today. A new look into cancer care, the added value of integrative oncology. My name is Tito von Schönangerer. I'm a pediatrician in Geneva, Switzerland, and I'm the vice president of the International Federation of Anthroposophic Medical Association. And I'm giving right away the floor to Professor Dr. Georg Seifert at the Charité in Berlin, who will give the opening remarks. Please, Georg.
Yeah, thank you, Tito, dear audience. Before we begin, let's reflect a little bit on the genesis of this webinar, because last year on June 7th, the member of the European Parliament, Manuela Ripa, hosted a breakfast roundtable at the European Parliament, organized by EuroChem. And the aim was to delve into the role of integrative oncology in enhancing patient outcomes during cancer treatments. And out of this gathering emerged a clear call for a European network of integrative oncology, recognizing its potential to transform cancer care across Europe. And so today's webinar is a continuation of that momentum. Organized by Charité and EuroChem, we are committed to contributing to the establishment of this network. Our goal is, in general, to translate scientific knowledge and clinical experiences into tangible policy decisions, creating an environment where traditional and integrative medicine can thrive, not just in Europe, but globally. So I'm particularly excited to share that this webinar is deeply aligned with the mission and the vision of the Charité Competence Center on Traditional and Integrative Medicine, a project that is currently being operationalized. And as the director of this center, I'm honored to lead this initiative, which represents actually the culmination of my lifelong dedication to advancing traditional and integrative medicine. Our center is poised to elevate the agenda of traditional and integrative medicine in Europe and around the world, advocating for its integration into mainstream healthcare practices. And therefore, we couldn't be happier to be part of the organizers of this discussion. Today, we have a diverse lineup of esteemed speakers who will share their insights and experiences from different angles. And together, we will explore innovative approaches to cancer care through lived experiences and discuss our contribution for a brighter future in oncology treatment. So without further ado, I pass the baton to Dr. Tito Schönangerer again, who will expertly moderate our session. So thank you for joining and have an enjoyable webinar.
Thank you so much for the introduction. So I will be co-moderating the session now with Dr. Iba Bujna. Iba, maybe you briefly introduce yourselves.
Sure. Thank you so much, Tito, and thank you, Georg, for the opening remarks. I'm extremely happy to be here with you today to discuss such an important topic. My name is Iba, and I work with Georg in Charité with the Charité Competency Center for Traditional and Integrative Medicine, CCTIM. And as Tito said, I will be co-moderating this session, and I look forward to a fruitful conversation with you. Over.
Thank you. So in this short hour, we have a very interesting program. We will now start with some introduction by the MEP Interest Group of Integrative Medicine and Health, who's really hosting this webinar today. We will then get some introduction and views from two esteemed experts in the field. And very importantly, we will really have time to hear from 2 patients today about their experience and what they think they need. So I hand over to Adriane Wald, who is the coordinator of this MEP Interest Group of Integrative Medicine and Health of EuroCan. And she's also the head of advocacy at the European Traditional Medicine Association, the ETCMA. She's actually a nurse and an acupuncturist working in a conventional hospital in Belgium. So over to you, Adriane.
Thank you so much, Tito. So the interest group of the members of the European Parliament on Integrative Medicine and Health was established in 2019, following the success of the interest group of the previous legislature. So EuroCan has the honor to run the secretariat of this interest group, and also firmly believes that the next European Parliament will show strong support for integrative medicine and health, and also that the MEPs will establish the 3rd interest group on this topic. So EuroCan represents 60,000 organized patients, 250 national associations, and also a significant portion of the 400,000 physicians, veterinarians, and practitioners in this sector across Europe. So the objectives of this interest group are to make traditional, complementary, and integrative medicine more accessible, available, and affordable. This also by proposing and undertaking legislative and political initiatives, showcasing better practices and research findings for also more evidence-based health policies. Also to support the increase of public and independent research budgets. So EuroCan calls on the next European Parliament and Commission to make crucial strides in providing integrative care and sustainable health for the citizens in Europe. So this would have a tremendous contribution, and specifically also in addressing the severe challenges that impact EU healthcare systems nowadays, such as antimicrobial resistance, mental health, and non-communicable diseases like cancer. So now I'm really glad to invite Manuela Ripa to the floor. She's a German MEP who's an active member of this interest group on integrative medicine and health. And her insights will shed light on the political significance of this webinar. So thank you so much.
Thank you very much for this kind introductory words. And thank you very much for inviting me also to this event today. And I would like, I'm happy to give some introductory remarks on the integrative oncology and how to integrate conventional and traditional and complementary treatment modalities into cancer care. Moreover, on how to share better practices across Europe, because Europe is also to learn from one country to the other and to share best practices. We should not forget this. But why is integrative oncology so important? Well, for me, we need, and as Adriana rightly said, we need a holistic and patient-centered approach to cancer care. And I learned that integrative oncology can ease the patient's suffering, address the important emotional and psychological impact of cancer, as well as alleviate symptoms of the disease and ease the side effects of conventional treatments. And this should be, in my view, absolutely fostered at European level. What is the situation in Europe? Well, in 2019, nearly 1.2 million deaths in EU countries were attributed to cancer, representing over a quarter of all deaths, making cancer the second leading cause of mortality in the EU. Cancer is a terrible disease that imposes a heavy burden on individuals and society, affecting psychical, emotional, and financial well-being. That is why, as a member of the Special Committee on Beating Cancer in the European Parliament, I focused a lot on prevention, because the best way to cure cancer is, of course, to prevent it. But unfortunately, this is not always possible. And that is why we also have to look at how to best cure cancer. And managing cancer involves coping not only coping not only with the disease itself, but also with its side effects, many of which are caused by treatments. These side effects, including pain, nausea, anxiety, depression, can significantly impact quality of life and daily functioning of the patient. Fortunately, effective cancer treatments do exist, such as chemotherapy, immunotherapy, or radiation therapy. Moreover, traditional complementary and integrative healthcare treatments can be integrated with conventional approaches to alleviate suffering and address emotional and spiritual impacts of cancer. We will hear more about it from the experts, but also from two persons who are affected by this. And I can only repeat, healthcare should prioritize patient-centered approaches, empowering individuals to actively participate in their care decisions. People's right to the highest attainable standard of health implies the availability and affordability of integrative and complementary methods for all the EU citizens demanding it. And this includes a large part of the cancer patients across Europe, between 24 and 45%. In a strong European health union, addressing cancer needs to become a shared political, operational, and research priority. For me, more investments in research for integrative oncology is one of the keys in the European response against cancer. Finally, new Europeans Beating Cancer plan must also include the learnings and evidence from integrative oncology. Europeans expect and deserve to live in a society that protects them from avoidable cancers and that provides equitable, affordable, high quality and sustainable cancer care, including integrative cancer care, to those who need it and ask for it. During this legislative period, I've been fighting wholeheartedly for recognition of integrative therapies that have been proven to be effective, and I have been in constant contact with organizations that are promoting them, especially in Germany. Moreover, I have managed to mention the importance of these methods in the Beating Cancer report of the European Parliament, and I've asked the Commission to dedicate more resources available towards research on integrative medicine in order to get some of these treatments officially recognized as effective. Furthermore, and this was also mentioned by Dr. Seifert at the beginning, together with this intergroup and with a colleague of mine, we have organized a conference in the European Parliament on integrative oncology. There we also discussed hyperthermia, one of the integrative therapies that have been proven to be effective. And I can only promise that if re-elected, I will keep fighting further to make life easier for thousands of cancer patients across Europe. And I very much hope that we will re-establish this intergroup that is so important to not only talk about the therapies that we know, but also about other approaches that need to be also bring to the attention of cancer patients across Europe. So thank you so much for listening to me, and I'm looking forward now to hear the experts, and I wish you a fruitful further discussion. Thank you very much.
Thank you very much, Madam Rieper, for your introduction, your strong support, and your important work. So thank you. So I will introduce now two fantastic doctors to lead us through the next part, and it's Dr. Eran Ben Aryeh, who is a specialized in family medicine, and he's a co-founder and director of the Unit of Complementary and Traditional Medicine at the Department of Family Medicine, Haifa, Israel. He's also director of the Integrative Oncology program at the Haifa and Western Galilee Oncology Service. He's involved in many activities, and one thing where I've seen Eran is really also in this Middle East research group in integrative oncology that brings really experts across the entire Middle East together to exchange and to see how to treat patients of different origins from the entire region. So I think it's a medicine of peace that I think this group is practicing for many years, and I'm very pleased and thankful that Dr. Eran is able to join us here. And he's also, just to mention, he's part of the American Society of Clinical Oncology Guideline Development. The other speaker here is Dr. Khalid Suhouli from Berlin, Germany. He's a gynecologist and oncologist, He's a professor of gynecology and the deputy director of the Charité Comprehensive Cancer Center in Berlin. And he's founded the first ovarian cancer center in Berlin and has wide expertise, including experimental surgery, surgical gynecology, oncosurgery, and doctor-patient communication. So thank you for being here. And I will give the word to you, Dr. Aaron, tapping on your many years of experience. Maybe you can give us a short introduction, tell us what is integrative oncology, what is meant under this term.
Thank you, Tido.
Please.
Well, the term integrative oncology is defined by our Society for Integrative Oncology, which is an international society of above 600 practitioners and researchers, clinicians from 50 countries all over the world. It's defined by a patient-centered and evidence-based modality. But you know, I mean, from practical point of view, integrative oncology, from where I stand as a clinician and a researcher and medical educator, is the place where we can provide free of charge integrative practices to patients where oncology treatment is being provided. It means in the chemotherapy daycare clinic, as part of surgery, as part of palliative care, as part of survivorship, as part of end of life, doing that at the inpatient facility at the hospital or the outpatient in the community. So it's exactly part of what oncology is. I mean, it's part of supportive and palliative care. It corresponds with that. And it includes a variety of modalities. But beyond, you know, the different modalities like herbal medicine and nutrition and TCM, traditional Chinese medicine, Ayurvedic medicine, mind-body medicine, manual and movement therapies, and so on, music therapy, anthroposophic medicine. It's not just the modalities. It's the attitude. It's the way that we perceive people as a biopsychosocial and spiritual human being, as a person rather than a patient. It's a personalized medicine where we want to listen carefully to the patient's health beliefs, expectations, assess patients' quality of life concerns, including side effects of oncology treatment, specifically those side effects that have currently no optimal treatment provided by conventional care, and to support patients through their journey, to enable patients to adhere to the oncology treatment and to facilitate their own capability to recover, to thrive throughout this journey. So it's a place where professionalism is needed. It's a place where we need to train physicians, nurses, paramedical therapists, and leading complementary integrative medicine practitioners with very high challenges, and to be part of the medical paradigm, to enrich the medical paradigm.
Thank you, Dr. Aaron. That's a beautiful explanation, introduction. Professor Cerulli, I mean, in the preparation, you have mentioned that integrative oncology is already part of the continuum of oncology today, although it's not always called like that. Can you explain this a bit further and provide practical examples from your work? And so, yeah, as Dr. Aaron, we just have three minutes.
Yes, it's my pleasure. And thank you very much to be part of this outstanding initiative. And only to give you some teasers. So I'm a gynecologist doing surgery, doing chemotherapy, doing many treatments. And everybody is aware that we have more and more complex treatments, personalized medicine. more targeted therapy are used. But the question is, and this is what we like to bring with Aaron into the field, it's not vice versa. It's, if you think about the World Health Organization definition, so it's defined by physically, mentally, and social well-being. And I think there are many, many opportunities to strengthen the health. And this is one topic, rehabilitation. Before you go to surgery, before you go to chemotherapy, you can use integrative medicine to empower the patient, but even to strengthen the health. And a part of this is between the things we have to offer regarding survival, quality of life, recurrence-free survival, is even to bring, for instance, creative therapy. These are the results of a study we did from Charité. And there's a high need of patients to use creative therapies to overcome fear and even to empower the patients for the treatment decision-making process. And that's the reason why we introduced 4 years ago creative therapies for cancer patients. And it's wonderful, the products, but that's not the goal of the product. It's more the reflection, more the empowerment to go in dialogue. And another topic, what I even like to touch, is that many patients have decreased sensitivity and disturbances based on chemotherapy. For paclitaxel, for instance, they cannot any more smelling. And that's the reason why we even did a study in aromatherapy to empower patients, because tasting, smelling, appetite is a big association part. And this is something what we like to bring into the field. So to look how we can use it for best supportive care as a tool, and to integrate even other professions as a part of this global concept and healing architecture. So we take time for all the chemotherapies, waiting time, but we have even to think to change the environment of the patients and to use even natural ways to empower the patient, beside the backbone of evidence-based medicine and the best treatments regarding surgery, chemotherapy. That's from our advocates from Germany. We demanding a prescription for patients for creative therapy, not only for psychiatric patients, even for cancer patients. And this is my final slide, because we are sending from Rudolf Virchow. And he was a pathologist, but he was a humanist, he was a politician, and he demanded the summa medicinae. So it's always the story of the sum. And omnicellule is cellular, but in the context of social cultural aspects. And this is the reason why I'm so happy to open with you this dialogue and to change the perspective of our healthcare system. Thank you very much.
Yes, thank you so much. Yes, thanks for bringing us back. You made great use of your 3 minutes to show us also some good pictures and give us also a good introduction. We're running a little bit late, and I'm very conscious that we need to put the patients at the center. So just give one question back to you, Dr. Aaron, because you're the regional ambassador for the site of Integrative Oncology to Europe and the Middle East. And can you say something about how is Europe performing in kind of this global integrative oncology movement, and where do we need to go next?
I think that, often we compare to the US and North America, and there is no question that in terms of research and practical guidelines and the alliance with ASCO, with the American Society of Clinical Oncology, the US is really leading. But if you look at what I can call practical integrative oncology in daily care, in clinics, Europe is much more an important site where these processes are taking place. And it happens mainly, integrative oncology centers are mainly located in Germany, in Italy, in the UK. It's now starting here and there in other countries, a little bit in Spain and Portugal, in France, two important initiatives that recently have been launched in the Netherlands, in Scandinavia. And I would also, and of course in Israel, I mean, in Israel, there are 10 centers of integrative oncology in this tiny country. But I would also say that what is mostly needed is the collaboration of these integrative centers all over Europe with the political impulse, the European Parliament, with the professional authorities in oncology, namely ESMO, the European Society of Medical Oncology, and other medical societies and surgical societies. This is really what is needed. And when you look at ground scale, the most important initiatives, I think, is the one that is in southern Germany, what is called KIM or KIM, that takes together different medical initiatives inside the hospitals and the outpatient facilities, and the ARTOI, which is the Italian National Society for Integrative Oncology. In terms of political and powers, those are the leading authorities, but there are many collaborations that are now sprouted through what we have recently launched as SAO Europe, and I hope that in the next webinar we can talk about additional advances in the field.
Thank you, Dr. Aaron. I will now hand over to Hiba so we can hear the patient voices, and then I think both of you will come back when we have the question and answer session. Over to you.
Thank you so much, Tito. I hope you can hear me okay. Thank you so much, Dr. Sehouli and Dr. Eran for the insights, and Madame Lipa for really giving us the context in Europe and where we need to go. So today, as Tito explained, we have two patients with us who gracefully made the time to join us and to really share with us their lived experience, having to deal with cancer and having had exposure to integrative oncology. One of our patients who is with us today, Veronique, is from Belgium and will tell us about her experience in receiving integrative oncology in Europe. And we also have with us Maden, who is logging in from Israel and who will tell us about her experience there. So I would like to start with Veronique. Veronique, I hope you can hear us okay. And Veronique has some drawings for us today as well, because Veronique expresses herself creatively and she organizes her thoughts in drawings, which is beautiful. And I think also integrative oncology and her journey facing cancer for the second time has really unlocked for her doors to her creative self. So Veronique, I'd like to ask you, you and I spoke a lot in preparation of this event, but I would like to ask you to briefly share with us your journey with cancer and how you really discovered integrative oncology.
The third time was when I actually got cancer in 2016. Before, I had already been in touch with my acupuncturist, who helped me because I had asthma, I had allergies, and the products that I was given by traditional medicine were bad for the teeth. And as I have a sister who is dentist, I didn't want to lose all my teeth. So that's how I got in touch with acupuncture many, many years ago. And in 2016, when I was diagnosed breast cancer, I was afraid of all the side effects that I would have because of chemo. So I asked my acupuncturist, Sophie, can you help me? And she said yes. So thanks to her and thanks to all the creative coaching I had followed, I'm also a neurolinguistic practitioner. I'm an artist. I'm a language teacher. I'm a mother. I'm a daughter. So all these helped me into, yes, treating with cancer in an integrative way. And I'm so happy to see that there is much more for me yet to discover and for all those patients.
Thank you so much, Veronique. This is beautiful. And we know that Madame Lipa also really reminded us that integrative oncology is also about easing the suffering of patients, especially when it comes to side effects. And you really explained this beautifully. And Dr. Iran reminded us that it's about seeing the patient as a whole person and not just the sum of organs that are disconnected from each other. And Dr. Sehouli also reminded us of the power that art could hold in really facing cancer and in navigating this journey. To switch gears to Maden and hear a little bit about her experience with treating cancer. Maden has received almost 50 sessions of integrative oncology care as part of her treatment. She has a wealth of knowledge in integrative oncology. We would love to hear from you, Maden. The floor is yours. Please go ahead.
Hello, everyone, and once again, all organizers and Hiba for inviting me to this very important and relevant seminar. I was diagnosed with triple-negative breast cancer in July of 2023 and started my treatment in August of 2023. And I think there are 3 points that I want to make in 3 minutes. First point is that when I had to choose where to get my treatment, I chose Lean, where Dr. Iran is, because I knew that they had the integrative and holistic approach. And I was already aware of a holistic medicine. I had been treated before for allergies and other things. And so I knew that I would want to have that as part of my treatment. In Israel, you can choose, if you have a specific health plan, to go to one of the clinics or hospitals in that health plan. And I didn't know that it's not available in every clinic or hospital until I started talking to friends that had cancer. And I said, well, I get this and I get that. And they looked at me as if I was a stranger. I have a social worker and I have a dietitian and I have the complementary therapies, and they're all a part of my treatment. So that's a very important part of my journey, is that finding the right place that knows that I know will give me the best treatment. And for me, that it had to have integrative oncology. I think the second point that is important, and I think that Madame Lipa mentioned that, is the emotional support. From the very beginning, and I didn't know it, but I was told that it only gets worse before it gets better. And that emotional support for the days when you feel down or frustrated or fearful, or you feel like you have no control over what's happening in your life, to have that person that isn't the one giving you the chemo, but the one that's listening and helping you to choose what treatment to get for that day. I never came to a treatment in the morning and was told, this is the acupuncture treatment that you're going to get today. I was always asked, how do you feel? And what do you need today? And sometimes I needed to have a mediated imagination, meditation, and not acupuncture. So it was very important to know that it was really patient-based on how I was feeling that day. And I think the third point that is probably the most important, once you have this ability to be a part of an integrative oncology department, is the communication between the different medical staff. It's not enough that everybody knows how important it is. You have to work together along with the patient. It's a triangle. It's the person who's going to give you the conventional treatment, the nurse. It's going to be your oncologist. It's going to be the person who's going to give you the treatments, complementary treatments, and it's the patient themselves. Working together to make sure that the nurse is okay with 20 needles in your body and can put in the medicine that she needs to do, that there's timing and synchronization between the different people that are helping you. Because the ultimate goal, and I think everybody said that until now, the ultimate goal is to make sure that the patient feels well and is leaving their treatment in a positive, with a positive attitude, that what I did today is going to help me to heal. Both the conventional and the complementary treatments together strengthen a person. And that's what we want to do, strengthen them both emotionally, physically, and spiritually. So for me, that was a big part of my journey and still is. I still have a few more months to go. So I can actually say I'm looking forward to coming back to Berlin and to continue my treatments there. Once again, thank you for this opportunity to share my journey with you.
Thank you so much, Madame. This was very clear, and thank you so much for sharing with us your knowledge and your wisdom. It's really through the words and the perspective of the patients that we can look at things from a wider angle and from different perspectives. And we need to have really the doctors, the patients, the family, the friends, the politicians, the policymakers, everyone together, and the citizens around this. And so we have talked a lot about integrative oncology, what it is, why is it important, how are we doing in Europe, and the challenges. Now, I would like to turn it back to Véronique, very briefly, Véronique, in 1 minute or two, so we can open the floor for questions. How do you think, Véronique, what can we change to make things better for patients, for them to navigate this journey smoother? What are your recommendations as a patient?
Education. It all starts at the source. I have almost 20. Can you hear me? Yes.
Yes, we can hear you.
I have an almost 20-year-old daughter, Katja. She's my real pride. She's actually, in 2016, when I was diagnosed with cancer, 1 month later, my sister was diagnosed with cancer, and my daughter's stepmother got cancer. Her stepmother died, unfortunately. So my daughter has been very much in touch with cancer. She studied for 9 years. She just started her practice. She wants to raise a family, and she says, Mom, even though I am very interested in all the other possibilities of integrative oncology, I don't have the time. I had to spend 9 years in my studies, and they did not get anything about nutrition, about stress, about acupuncture. So that is from one step. It takes a lot of time to get classical training. Second would be that it would be so wonderful to build bridges between the classical universities. And like in Belgium, for example, we have the Academisch voor Natuurgeneeskunde, Academy for Natural Holistic Medicine, so that these would work together, that there would be exchange programs where professors, students from the classical universities could go and teach or follow lessons in these schools, colleges, where they teach all kinds of aspects of integrative oncology. And I also know many of my friends who are interested in health. They go to follow the integrative medicine courses next to their job. So it would be lovely if all these disciplines could be put together. Please, please, please do that. It would open the mind of so many people.
Yeah. Yeah, thank you so much, Véronique. I think the message is clear, integrating all these knowledges in curricula, incentivizing people to get to know integrative oncology, integrative medicine, and to know how beneficial it can be to the lives of patients, their friends, their families, and society as a whole. Thank you very much. I think now we have the floor open for questions. I did see 2 questions in the chat. But I also wonder if we have actually 3 now. Yes. Tito, would you like?
Yeah, please. I mean, if people should write your questions in the Q&A. And before we take them, I just want to give briefly the word back also to Dr. Sehouli, now hearing the patient's perspective, needs, preferences, maybe also your perspective, how we can even better respond to that in the future, particularly in Europe.
So first, I think I want really to underline that we have to understand there's no treatment in the world for everything, for every situation. So it's very clear that if we deliver any intervention to strengthen the health or fighting against diseases, we have defined always the goal. The goal is it's best supportive care, is a survival, what is. And then it's very simple. It's not vice versa. So what we need is what you already mentioned, education, training. But the first step is attitude, commitment, trans-professional and transdisciplinary work, even science, arts, and to have a structured dialogue, not by chance, a structure. So I want that the artist is sitting with me in the hospital, and it's not an artist, it's a trained, dedicated artist who are able to bring even his competence into the field. It's a dialogue, it's a structure. It's not fighting. It's not black and white. So we need a structure as a part. And we need even a standardization of quality in every field. If it's dancing, is it chemotherapy? Is it surgery? We need quality indicator, and I think we are able to deliver this. So I think the structure is the key issue, because there are wonderful islands in the world, but there are too much sea between them. So we need the structure, and independent from the personal preferences, but there's no doubt, there is no way that we have to change the system.
Thank you. And Madam Ripa, maybe you can say a word how you envision to take this forward also during the new parliament after the election. Where's the role?
Yeah, thank you very much. And thank you very much to the amazing contributions that we just heard from Veronique and from Madine. It's really touching to hear that. And I think so many things were said that were rightly said. For example, that like Veronique rightly said, not everybody can pay for the right treatments, and this is something we need to tackle, and this should not be something that in Europe should exist. Everybody should get the treatment it deserves, no matter if he or she has money or not. And the other thing is, what I think is also very important, most of the cancer patients I also talk to, they don't even know that there are complementary treatments. They only know the classical treatment. So it is very, very important that we raise more awareness within the doctors also, because often they also don't know about complementary therapies, and that we raise awareness on both sides, that there are treatments that can help to ease the suffering of the patients, and that can be very effective. So we have to do more on both sides. And I think, the European Parliament doesn't have the competences on health, because this is still a member states issue. But what we can do at European level is to raise awareness, to make known treatments, also to compare between member states, to show that what treatments are working in one member state, which could work in other member states. So I think this is very important. And then to go on, we have a subcommittee on health, finally, to promote more these integrative approaches.
Thank you. I think also not to forget that the World Health Organization has just put out a new draft for its new traditional complementary integrative medicine strategy for the next 10 years. And I think it's a very helpful document, because it outlines a number of clear steps in terms of increasing investment and research, integrating it into the health system, and so on. I'm just looking here now at some of the questions, and maybe if I can give some of this to you, Dr. Aaron. I mean, there's the question was, what's the role of Ayurveda in integrative oncology? People want to know a bit more about the center in Scandinavia, but it's maybe something you can answer separately. Was a question, what's the role of mistletoe? So maybe you can share a bit what are the different therapies.
Okay, so let's talk about everything, okay? From Ayurveda to Nafkam to mistletoe. And
you can focus how you want.
Yeah, so first of all, Ayurveda is one of the leading traditional medicine modalities, very important in cancer care. Unfortunately, India is very far from integration in terms of integrative oncology. I'm happy to share with you that the SIO, the Society for Integrative Oncology, have now nominated an SIO ambassador to India, and we have a special interest group in Ayurveda within the SIO, and we're trying to promote integrative oncology in India. But this is the future, really, and this integration process between Ayurvedic people that works in India and outside India, in Europe, in the US, and the other parts of the world is really a very promising future for integrative oncology. Now, in Scandinavia, the center, what is called NAFCAM, the Center for Complementary Medicine Research, which is placed in Tromsø in northern Norway, where I was fortunate to be there for a month last year, is one of the leading research centers all over the world. And it's now more and more interested in integrative oncology, especially from the perspective, the very important perspective of safety and risks. And I hope that NAFCAM will be more and more involved in future years in integrative oncology in Europe. It is already doing a lot in this field and collaborating with us, with the SIO Europe. Now, regarding mistletoe, I wouldn't minimize that just to the herb, but to the context of anthroposophic medicine, which from my point of view, and I'm biased, I'm trained in anthroposophical medicine from Switzerland. But I think that anthroposophic medicine is one of the most important modalities worldwide, especially in integrative oncology. And there is a serious dialogue today in order to bridge gaps in research and medical education and clinical practice with other modalities, and especially with the SIO. So I hope that briefly I was able to reply to those questions.
Thank you, Aaron. Yeah, Dr. Suli, very briefly.
Very short comment. So I think it's very important that we are open to all resources in the world globally, from Africa, from India, from any geographic and cultural background, and then to identify the best elements for the best indication. I think this is very crucial, because if we look even on the field of complementary medicine, we have many areas are still not identified and not documented. So I think it's very important, again, attitude, to be open, but then to look what is the best element for what strategy. So I really like to underline this. Thank you.
Thank you very much. And there are now quite a lot of important questions coming through, also important points of nutrition. So too much for this session, but we will take note of this and also for the working group and see how to take this forward in the future. Now, with this, I have the pleasure to give the closing remark to Elisa Baldini, who is the chair of EuroCam since this year. She's also the Secretary General of the IVA, the International Federation of Anthroposophic Medical Associations. And Elisa will give us the closing remarks and I think some political perspectives that also, I think, will respond to some of the question that we haven't answered yet. Thank you, Elisa.
Thank you, Tito. Thank you, speakers. I would like to thank all the speakers for the inspiring discussions, the MEP Interest Group for Integrative Medicine and Health, Dr. Ben-Arie and Dr. Sehouli, our two patients, Veronique and Maden, Mrs. Ripa and her office, the European Society of Integrative Oncology and Charité, as well as EuroCam staff and members for organizing such a meaningful event. I am honored to provide the concluding remarks as EuroCam chair. Today's intervention have emphasized the growing interest and demand among European citizens for evidence-based integrative treatments as they seek cancer care that is comprehensive and aims at improving their quality of life through treatments planned in a holistic way. Together, we have the opportunity to improve the future of cancer care in Europe, ensuring the holistic support that is much needed for such a challenging journey. To ensure equal healthcare options in Europe, we must take action at regional level. EuroCam is committed to the creation of a European network on integrative oncology, together with all the relevant actors, to collaboratively address the European citizens' demand for safe, quality, and integrative cancer care. We are delighted for Charité's support in this event, and we continue to call on the EU institutions to support these efforts. In recent years, the European Union set ambitious targets to tackle cancer, with strategies such as Europe Beating Cancer Plan and the EU for Health Programme. Integrative oncology is increasingly recognized in improving cancer care and should therefore become an integral element of the EU response to cancer. Combining evidence-based practices from different medical integrative traditions with conventional cancer treatments optimizes both quality of life and clinical outcomes. Therefore, it represents an added value for patients, their families, societies, and health systems that should not be overlooked. Finally, I am pleased to announce that EuroCam, in partnership with Charité, will be hosting a series of events this year and throughout the next legislative period to advocate for the inclusion of integrative medicine and integrative oncology as part of public healthcare systems throughout Europe. Together, we can ensure that our patients are supported through empowering, comprehensive, and compassionate healthcare, which transcends boundaries and fosters a healthier and a more fulfilling life for all. Thank you very much.